All right, so welcome everyone, and thank you for joining us today. My name is Chris Frueh, and I will be hosting. Talent War Group is an organization of leadership and performance experts who share their lessons learned and insights on talent management, leadership, and organizational development. We rely on your support, and we wouldn't be here without it. So if you like what you hear, please share it with your connections and your contacts. And if you have questions and comments today, please send them through the chat function, and we'll do our best to address them during the session today. So our topic today is COVID-19, and I'm going to just lead off by saying I've been a doubter and a skeptic about much of what I've read and seen in the news, in the mainstream media, and a variety of scientific sources. I think, and I'm a scientist myself, so if I'm having some trouble sorting through all of the information out there, I think it's probably fair to guess that many of you are as well. So today we're going to talk about the current medical data and what it shows about COVID, including symptoms, treatment, epidemiology, risk factors, and of course the vaccine, the science behind the vaccine, and how to think about making decisions about COVID and quarantine and social distancing and the vaccine for your people, your organizations. So we'll do a little quick introduction. So my name is Chris Frueh. I have a PhD in clinical psychology, and I'm a professor of psychology at the University of Hawaii. I'm also a speaker and contributor here with the Talent War Group and a performance specialist with Great Ghost Solutions, and I'm affiliated with Houston Methodist Hospital. And I'm really excited today about today's topic. And I'll share that it comes from a series of pretty intense discussions with my longtime friend, brother, and colleague, Dr. Leonard Egede. We were baby scientists together in the late 1990s at the Medical University of South Carolina, and we've collaborated on many things over the years and taken many good hikes and had many good meals and conversations together. So Dr. Getty is a general internist. He's an MD, general internist, a health services researcher. He's a tenured professor of medicine and chief of the Division of General Internal Medicine at the Medical College of Wisconsin. He's also the director of the Center for Advancing Population Science. He's associate director of diversity in the Genomic Sciences and Precision Medicine Center, and director of several training programs, as well as several other. He's got a long list of titles and a long list of groups that he works with. He's a nationally recognized medical researcher. My friend Leonard's research is focused on developing and testing innovative interventions to reduce and or eliminate medical and health disparities. Generally, these health disparities are thought to be ethnicity, socioeconomic status, even geographic location. Most of his work, or much of his work, has been at the nexus of mental health and diabetes and other kinds of chronic medical conditions like that. Leonard has over 300 scientific publications, and I've had the good fortune to be included as a co-author on a few of these papers with him together. And he's been the lead investigator on dozens of federal grants, including 5 that are currently ongoing. If you're not a scientist, which I know most of you aren't, 5 federal grants at one time is a heck of a lot. He also leads a large funded project funded by the Advancing Healthier Wisconsin that's aimed at addressing health disparities in the inner city, African-American community of Milwaukee. And he's been at the forefront of COVID care. I mean, he's been leading, he's a hospital leader, and he's a clinician doing frontline care, and he's done research on some of the epidemiological aspects of COVID. And also, very importantly for our program today, he spent a lot of time reading, sifting through the data on both the Pfizer and the Moderna clinical trials that validated the vaccines and got them approved. We also have Mike Sarraille joining us today. You guys all know Mike, Marine Recon, retired Navy SEAL, Lieutenant Commander in the Navy, and he's the lead author of the best-selling book Talent War and the founder of the Talent War Group. And then last but not least, we have what I consider to be our secret weapon here with us today, Nayara. Nayara keeps the trains running, but she's also rather brilliant, and she'll prove that at the end of this hour by giving a phenomenal summary of all the things that we've learned today. So with all that introduction said, welcome, Leonard. It's good to see you. It's good to be here with you. Educate us. Tell us some of what we know now about COVID-19 in terms of infections, mortality, where it's been, where we're going. And then after we talk about that, we can get into a little bit about the mRNA technology, data on the vaccine, and we can even address some of the myths and misconceptions related to COVID. Over to you.
All right, Chris. Thank you for giving me a chance to share and have conversation about this topic. Obviously, this is an area where there's a lot of interest and a lot of concerns going on right now. I will start off by saying that, unfortunately, we have politicized medicine, especially the COVID vaccine. And as a result, we are having conversations that we never really have when we deal with healthcare and healthcare issues. So just to start off, COVID right now, we have about 22.9 million cases going on with COVID and about 381,000 deaths from COVID. And this is from since the pandemic started in March of this of last year, and those numbers are staggering in terms of mortality, in terms of infection rate, but also the number of people who have died. And one of the reasons for that is that, one, we have a virus that we really don't know very much about, or at least at the beginning of the pandemic, we really didn't know very much about the virus. As a result, we've been scrambling and essentially working on the fly to figure out the virus, to understand what is going on, and to actually address the disease. But I think what has really slowed us down is the idea of this whole the politics that has gotten involved. So the virus is very deadly. People are dying from it, and when people say to you, "Well, and it may not affect me," it's affecting people. It started off with affecting people who are mostly elderly and those with chronic disease. But where we are right now is all age groups are being affected, and people who are dying cut across all age groups, young, middle-aged, older. And so it is no longer a disease of a specific group. We still have some groups that are more likely to have the infection. So we still have minority groups are more likely to have the infection, and they're more likely to die from the infection. But by and large, right now, all segments of the population are affected and impacted by COVID. So COVID is one of those things we can't ignore. And in terms of the spread of the infection, it's something that is spread via droplet infection. So when people cough or they sneeze, they can actually spread the virus. Now, the simple way to actually prevent COVID, based on all the evidence we have, are three things. One is wearing a face mask and wearing it regularly. Two is social distancing, which is essentially staying about 6 feet apart from individuals who are not part of your bubble or your safe people who are part of your family. And the third is the whole idea of hand washing and sanitizing. Now, as simple as those three things are, we've had a very difficult time from the healthcare community getting people to follow some of those processes. As you can imagine, wearing a mask is not comfortable. And for many people, it is really challenging. However, from evidence we have, multiple studies that have been done so far, but also evidence from the flu pandemic that happened many, many years ago, the three strategies actually work. So wearing a face mask on a regular basis when you're outside of your home, social distancing and washing your hands and sanitizing your hands regularly. Now, you would imagine that with that level of evidence, everybody would adopt these processes, but it turns out that the adoption rate is so low that we are actually now having a situation where hospitals in California, New York are saturated. They are at the point where they're turning people away because they have no beds for them. So this pandemic is real, it is dangerous, and it's actually killing people. So that's, I think, is important to be to kind of set the stage, because when the conversation that tends to happen is people say it's not as serious, I'm not at risk, it may not be me, certain types of people, everybody is at risk, everybody can be impacted, and there are measures in place to protect us. So that, I think, is the first point. And the numbers are climbing. I mean, it's staggering to watch this, the way the numbers continue to go. So one conversation I have on a regular basis are people who ask questions about, how are we sure this is real? How are we sure these numbers are real? So a key point that people need to pay attention to is that, as a scientist, we have processes we use to define disease, and these processes are not taken lightly. You have, if you know about science, scientists they challenge existing paradigm. So for people to accept that a disease is real, you have to have very strong, overwhelming evidence. So first of all, what we do is we ask ourselves a question: compared to this time last year, how many people have died? And if you find that the numbers of people who have died are higher than what it used to be last year, it means something different is happening. So, and that is where we are right now. The people who are dying are more than what should have happened based on chance alone. But the second thing is, you ask yourself, what are the factors that are tied to that increased death rate? In this case, the only factor that seems to be different is COVID. So when people go into the hospital, if they don't have a COVID infection, the pattern is the same as someone who has the pattern we've seen in the past. But once they have a COVID infection, the death rate increases exponentially. So we know that COVID is actually responsible for those deaths. The other thing we are able to tell is that we now have the ability to look at we do CT scans, we can look at people's oxygenation in their lungs, and we can tell that something is happening to them as a result of this virus. And the other thing I will mention is that this virus is not, coronaviruses are not new. We actually know about them. We just do not know very much about this specific type of coronavirus. So prior infections, we know that when you have coronavirus, it affects the lungs, it has impact, and it actually has very high fatality rate, which is death rate. So I think when people argue that, are we sure these deaths are due to coronavirus, it ignores very strong science and scientific principles. So I will stop there, and then I'll let Chris kind of ask the next question.
Well, so I think we have a good question from our listening audience. So Leonard, what is the lethality of this virus? And if we take people who are not elderly, who do not have underlying conditions, who are not significantly overweight, what's the lethality of this in the population of people who don't seem to have any of those risk factors?
So, Chris, that's a question I get all the time, and sure. And the idea behind that question, and I'll tell you what people are really asking, and then I'll explain to you what the issues are. The idea behind that question is, am I at risk? Because what people are trying to say is, I'm not overweight, I am not elderly, so maybe I'm not at risk. The issue is that, like I mentioned, we don't know a lot about this virus. We're learning on the fly. So if we look at data from China, we actually assumed from China that people who were dying were elderly and those with chronic diseases. It turns out that in the US, those presentations have changed. We started off with having people who had chronic diseases who were elderly dying, but now we're actually having young people. We have people who are 18 and older who are dying. We have people in the 20s who are dying. And the key thing is that we actually don't know what are the risks for people dying. We know that when you have certain types of individuals are more likely to develop severe disease, but we actually don't know if, on an individual basis, if you will actually be one of those individuals based on the current evidence we have.
So, Leonard, I think it's probably fair then to summarize your perspective that anybody who catches this could be at significant risk of a very real, long-standing illness or potentially even death. What's changed? You said that at first it was mostly people who were elderly or had underlying conditions. Why do you think it's now affecting? Why are the numbers now going to younger people and healthier people?
So it's initially the two main issues. One is that at the very beginning of the pandemic, we shut down, and because we had that shutdown, we actually limited the number of people who were exposed, and so we could actually identify who was exposed, and we could actually do tracking. Once you get to community spread, which is where we are now, where you actually, it's very difficult to identify who's spreading what. At community spread level, now we have exposure to all groups of individuals. So, college students are being exposed now, younger age adults are being exposed, people who are not in the workforce are being exposed, and then people who are actually in the workforce are also exposed. So what the key thing has changed is that exposure rates have increased. We have more people being exposed, and now we're beginning to see, a lot of the impact across populations.
I think Mike has a question and a comment. Do you want to chime in here, Mike?
Let me speak, and I don't want to speak for the viewers, but I'm assuming a lot of them feel this way. One, Leonard, I couldn't agree with you more. The politicalization of this was disgusting. When we should all be banding together to identify, the immunization to safeguard people as quickly as possible. People politicized it going into a 2020 election. Now, as business leaders, and majority of our listeners are business leaders, we can't afford another shutdown. The first shutdown, we can say, also caused a mental health pandemic, and it's also created a jobless pandemic where many small businesses are at risk of going out of work. And when those small businesses go out of work, people lose their livelihood. So I think there's a lot of frustration amongst the American populace. Where do we go from here? What are the chances of another shutdown? What do you say to a business leader who just can't afford to have their people working remotely? Because let's be honest here, you have low collaboration when people are working remotely. Your productivity dies. I don't care what any other studies are saying that remote work is as efficient as people being co-located. That's just not true. So what do you say to business leaders? Is another shutdown possible? How do they make decisions to safeguard their people while keeping their businesses solvent?
Very, 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 I couldn't agree with you, Mike. I think this is an area where, so when this all started off, we had three camps of leaders in the health space. A group that said shut everything down and literally shut the country down for months. Another group that said, you know what, we can't afford to shut down and we just need to keep things open. And then those who were in between. I happen to be in that middle space where we needed the initial shutdown to at least get a handle on the virus and get a better understanding of what is possible. And then once we had a good understanding of what we're dealing with, the pattern of spread and all the things that could be done, the next phase was a reopening that was a staggered reopening, which is what most states have done. The staggered reopening where you actually take essential services and you begin to open them in a logical fashion. I think for businesses right now, I can tell you that another shutdown is going to be literally catastrophic for the nation economically. We can't afford to have that. However, for us to avoid that, people need to follow the guidelines that are in place. So if you're a business leader, and I've seen that at my institution, when we implemented face mask, mandatory face mask, social distancing and hand washing, we were able to keep the numbers in check. And that's how, I've been going to work every day since this all began. I have a team of people who work with me. We're doing research on COVID. So we have to actually engage people. And this is how we've actually prevented people from getting the infection. So I think that if businesses really take this seriously, they avoid the politics, because the politics is really what is kind of making it difficult for us to get things done. The simple message is, if you're a business owner and you can mandate wearing a mask while at work, the social distancing and hand washing, you can open up safely in a reasonable fashion and be able to maintain a way to actually continue to maintain the economic growth without jeopardizing the health of your employees.
So it sounds like this comes down to accountability as a business leader, is follow the protocol and you have a higher probability of safeguarding your people, which means it's okay to be in workplaces, but try to follow the protocols as strictly as possible.
Yeah, exactly. And I think part of the challenge is that so you go to restaurants now. Restaurants want to open up, but they don't want to enforce those guidelines. You can't have it both ways. if we're going to open up, we need to follow what we know works. And then the moment this vaccine is publicly available, that is essentially going to be the big solution that we need to actually wait for. So I think right now, if I were a business leader, my priority would be to get good evidence from the health department, from any of the individual CDC and all those guidelines, and implement as best as possible. Social distancing, staggering, people's in the work environment, the face mask, and then the hand sanitization, and enforcing it. And businesses that have done that have been able to keep the spread of the virus to bare minimum.
Leonard, let's switch gears a little bit here and talk about the vaccine. So tell us a little bit about the mRNA technology. Some people are wondering, how did we make a vaccine so quickly? Was the process rushed? Did we skip steps? Is this have we not really dotted all the I's and crossed all the T's here? Or is this good science? Were the studies rigorous? Do we have a vaccine here that we should be taking? Should I take it? I mean, I think that's the question that many Americans are wondering.
I'll start off by saying that I have taken the vaccine myself. I had the first shot, I've had the second shot, and very minimal symptoms, maybe barely having some aches and pains at the injection site. But I'll start off by explaining that we have three main ways we actually address vaccines, how we create vaccines. The first is to take a virus, the dead virus, and you inject it into people with the hope that it will generate immunity. So the virus is dead, but you inject it into people, it generates immunity. The second is to take a live virus, you take a low dose of it, so you actually stimulate an infection, but it is not enough to get people sick. And so that's another way of getting it. The third is this new approach, the mRNA, which is essentially getting a copy of the virus, but not a live virus. So you are creating it in the lab. You get a good sense of what the virus looks like. You create it in the lab and you inject it into the individual. And because it's not a dead virus, it's not a live virus, you can't get an infection. But also because it's mRNA, it actually goes in and it creates an immune response that is very, very effective. And actually, the mRNA's technology has been around for about 15 years. The difference is that at that time, it was being used for cancer drug development. So most of the mRNA were people who were trying to targeted therapies for cancer. It turns out that once they found out that the coronavirus was here, people began to ask, could we use the same technology that we've had for 15 years? Can we now use it to address a pandemic? And that's how these mRNA viruses have come around. And there are two of them, Moderna and Pfizer are the two that are using this mRNA approach. It is a very well-studied approach. It's been, like I said, it's been around for 15 years. The advantage is that one, you're not giving a virus, dead or live virus. Two, you can produce it in the lab very, very rapidly. The only disadvantage of the mRNA virus is that because of its structure, you have to store it at very low temperature. So literally, you have to freeze it at a very low temperature. That's the only disadvantage. But otherwise, it is safe. It is well known, very well studied, and it's reproducible. You can create it in a lab. Once you have the information about the virus, you can create it. What I'm really excited about is not so much the pandemic right now, is what this technology is going to allow us to do as it relates to future infections, even cancer therapy, because now we know we can actually inject into the system. It goes in and it mounts an immune response that is actually effective.
That's a really great answer and really important information for us. So should everybody get the vaccine? Is there anybody that shouldn't get it?
So I'll start off by saying the other thing that's important for people to be aware of is that the vaccine, both vaccines right now, they have what we call 95%, 93 to 95% efficacy, which means that if you get the vaccine, you are protected from getting an infection. And even if you get an infection, you do not get a very severe infection. So it actually protects you from getting the infection. So, and that number, 95%, is higher than with mRNA, is higher than what we typically find with other. So the guideline actually says that if you get 80% protection, it will be approved. So some of the other approaches are getting 80%, 87%. This messenger RNA is really what is getting us to 93 to 95%, which is really high for vaccines. And then the second part of that question is, should I get it? My message to anyone is, if you are offered the vaccine, take it. This is our best bet right now to control this virus. And if you're a business leader and you want your employees to be able to actually come back to work, this is about the only way forward. There's nothing else we have available to us other than the vaccine. And the speed at which we've actually gotten this vaccine, normally it takes about 2 years to get to where we are now. It is because of this new technology that has allowed us to accelerate production and gotten us to where we are today. So most of us are very optimistic that if we're rolling this out at the pace we're going right now, and people embrace and take the vaccine, by the summer, we should get to a point where we've actually had enough people vaccinated that we actually can begin to get back to life as it used to be.
So I want to go to Nayara now. Put her on the spot to ask a question.
I have a question myself. And would you say, doctor, that the mRNA technology is the safest of all methods?
So I would say that just based on how I explain it and what we know right now, it's not a live virus. It is not a dead virus. It is essentially a synthetic virus. So from that standpoint, it is a safe method. Like anything else, any medication, any treatment, we don't have enough information about what else could happen. However, based on 15 years of evidence, there is nothing that is going to happen that we have not seen previously. So I think I would say that the things are relatively safe in terms of this approach. And compared to other approaches, is the faster way to get to closure in terms of getting us out of this situation. And it's probably going to have the least amount of side effect in terms of who can get it. The other thing that's important is that when you have live virus or dead virus, certain types of individuals who are immunocompromised, people who may have infections, may not be able to take it. Because this is synthetic, it's actually created, more people can take it, and it's less likely to actually generate problems or side effects in people who may have some kind of immune compromise.
So Leonard, you have actually effectively persuaded me, this was a couple of weeks ago, to take the virus when I can. And now, and I'm very excited about what we're talking about, what I'm learning here today, but now I'm excited. I want to get the vaccine. I want to get it now. I want to go get vaccinated, but I got to wait in line. But one of these days I'm going to get vaccinated. When that happens, can I throw the mask off and can I go out and enjoy the world again?
Yeah, so this is actually being talked about right now in the scientific circles. So there are 3 phases that we need to go through to get to that point. The first phase is where you have everyone in your bubble has been vaccinated. So, whoever is in your household, people you hang out with have been vaccinated. That's the first phase. The second phase is when your state, when majority of the individuals in your state have been vaccinated. That's the second phase. Then the third phase is when the rest of the world has been vaccinated. I would actually say this is a great time to be an American. This is a great time to live in America, because being able to get access to this vaccine is just a great experience. So we are expecting that the idea is that you need about 80 to 90% of people vaccinated to achieve herd immunity. Some people say 70%, some people say 80%, but really once you get to a point where you have at least 80 to 90% of people vaccinated, then you can get to a point where you're no longer as worried as people getting infection. The other reason why you can't take off your mask right now, even if you've had the vaccine, is that it is possible that you may not get sick, but you can actually still have the virus and you can actually transfer it to other people, which is why we are asking. So for example, I have had my 2 shots. My wife hasn't had it. My kids haven't had the vaccine. So I still have to take precaution just so that I don't spread it to my children. So that's why we're saying we have to pay attention to take the time to get all of the people vaccinated before you actually relax the processes we have in place right now.
So Doctor, and I think so. If you guys want to meet you, perfect. So I think a lot of us are asking the question. I know this is hard to predict, but I'm sure the models are being run. When do you think we reach that 80-90% based off what we're seeing with the deployment of the vaccine right now?
Tough question, because what goes into that calculation is not only the availability of the vaccine, it also goes into uptake. So, and then the third component of that is efficacy across the board. So if I were to take a guess, my guess is that by the end of this year, if we get the uptake we're predicting, if we can actually get more people to take it, we might get to a point where by the end of this year, we may be able to get to a point where we have herd immunity. However, if people decline the vaccine, which is where we're going to talk about the myths now. If people decline the vaccine and you have people who are pushing back against the vaccine, we may not be able to achieve herd immunity on time.
So, Leonard, we have got a couple of really good questions from our audience. So let me go to some of these. So Tony White asks about the vaccine. If I've had the vaccine, can I still carry the virus and be contagious to other people, even though I have immunity myself?
Yes, and that's why we need to get to herd immunity. So even if you have been you've been vaccinated, you have antibodies, you can still have the virus. You just won't get sick yourself, but someone else can get sick because of you. That's why we're asking people to maintain the face mask, social distancing, hand washing until we get to the point where everybody has had a chance to get the vaccine.
Another question from Thomas Goodwin. As a leader, does incentivizing employee physical fitness offset some of the risk associated with the virus, essentially bridging the gap between vaccination availability and current operations?
I think because this is this vaccine is being authorized through emergency use authorization, at this point in time, by law, you cannot make it mandatory. And so that's why we're doing a lot of work with education. By law, because it's emergency authorization, you can't make it mandatory, unlike the flu shot, which is mandatory for most healthcare workers. This is not. So it comes to the point where I think the incentive is really more about education and increasing awareness. Because once people understand what is at stake and why they should be doing this, I think we can actually get more people to actually take the vaccine, and that will actually get to where we need to be. And then obviously we have the whole process of production. So they're ramping up production right now. At the early phase of this, there was concern about not having enough vaccine to go around. But I think we're getting to that point where production is up and we should be able to get people vaccinated as soon as possible.
Isn't that funny? Again, the politicalization of this entire thing has created this sense of distrust amongst the American populace. What do they say? The worst words? I think it was Reagan that said it. Hello, we're the government. We're here to help. It said, when you hear those words, run the other direction.
Yep.
Is getting experts, subject matter experts such as yourself, not the politicians, up front to put out the factual information that we know up to date. And it's okay to say, hey, we don't know. And you don't hear enough of that. And I think that's creating distrust. When somebody has all the answers, much like a lot of the politicians that are front and center that we see putting out the information about this pandemic, it creates distrust. Leadership, and Doctor, the entire point of the Talent Work Group is about leadership. That's what we're about first and foremost. Now, from a standpoint, there's some great things that have come out of this. You've seen our communities come together to get this vaccine out in record time. And I trust the vaccine is safe. I trust the people behind it, really put the due diligence in to make sure that they're safeguarding the American populace. But, Chris, looking at this, we've seen some of the biggest hypocrisy in this nation during this pandemic. And again, it comes from the politicians, not the subject matter experts. The politicians that put out, like the LA mayor, if we catch you congregating with your families in your homes, we'll shut off your water and your electricity. And then they do the exact opposite. People like the mayor of Austin, who said, hey, don't travel home during these holidays, yet gets on his private plane and goes to Mexico. There's so many examples of where our nation's leaders have not set the example one bit. They haven't held themselves accountable. And that's frustrating for a lot of us that are watching that, don't take a leadership position unless you're willing to set the example. And that requires a lot of discipline, commitment, and sacrifice. And we're seeing a deficit of leadership during this pandemic.
And if I could just add to that, Mike, agree 100%. And the damage is not just to that leader's reputation. The damage then is people like myself and many others start to doubt everything we're being told. Well, the mayor said, don't do this. And then the mayor takes a private jet and has a good time somewhere, goes to a fancy French restaurant, while we, the little people, are supposed to stay home and wear our masks. So it doesn't sit well, but it also, I think, then raises questions. Well, maybe this isn't really such a dangerous thing, because obviously they're going and living their lives.
Leonard? Yeah, so I think you both of you have actually touched on what we've actually had in this process is a lack of great leadership, because I would argue that science has always prevailed. I've been in this business for a very long time. Science will eventually prevail if you get good minds together and just allow them to figure out what needs to get done. They'll find solutions. What we've actually had a problem with, the first thing that shocked me was just PPE. How can we be so dependent on China to get PPE? It was unbelievable that we couldn't get face masks. So then we get to a point now where we actually have great scientists who have come up with all of this technology, and we just can't rally and say, look, this is the right way to go. Let's get it done. So I think, like Mike was saying, what has come out of this whole process is a challenge to leaders to actually ask themselves, are you actually ready to lead? Are you going to lead by example? Are you actually going to believe? So as a scientist, I believe science. This is what I do. So for me not to actually believe science, it's like saying, why am I a scientist? Same thing, if you're a leader, why are you not able to lead your individuals and be able to engender trust and confidence based on your role as a leader? So
doctors, and I don't want to focus on the negative, but there's some great questions about the vaccine and the long-term effects, but is it safe to say that from talking to all my circle, all the people that are in the medical community, you guys are a little frustrated with government as well and government leaders?
So I think, so for most of us, I can speak for most health folks, Dr. Fauci is a beacon of hope. He's the one person, and I can tell you that the two things before, the reason why I actually took the vaccine myself, the first was that I trust Fauci. I know, he's a good scientist. He's been doing this for a long time. If he says this is safe, at least I have to believe him. But secondly, these two vaccines went through peer review. Our standard of science is to actually have it reviewed by scientists and get published. So I was not going to take the vaccine until I got to a point where it had been published. Both of them are published in New England Journal. So at least we know that at the very minimum, 4 to 5 top-level scientists have reviewed this and made a decision that the data is strong and it's really effective. So I think that's where kind of where the trust is. And if they allow the scientists to lead, the politicians have their role, but they have to allow those who are the expert in this area to lead and say, this is what the evidence shows. I think we're going to get stronger adoption if we did that.
That right there, just what you said and how eloquently you said it just sort of changed my view on everything. Is that if you, with your years of expertise and what you've achieved, trust Fauci in the peer review process, that's what we need to hear, but we're not hearing that is the problem.
So if I could just put my own spin or interpretation on that, because this is a very important point. The science that we're talking about, and by the way, we hear, follow the science, let the science lead us. Science doesn't answer all the questions. Science can't tell us what to do from a policy perspective. It can tell us about the virus, but it can't tell us necessarily what is going to be the best approach for any individual business, or what would be the best social policy as a nation or a state. I also know scientists don't always agree on things, but I think the point to emphasize here is this vaccine, these two vaccines, and the clinical trials that allowed the FDA to approve them were done by real card-carrying, formal, officially trained, highly prominent individuals who are scientists. This was not a product, this was not a process that was influenced by or pushed directly by any politician on the left or the right. This was the internal workings of the medical and scientific medical community that came up with the vaccine into these studies. So I think the point I guess I'm trying to say here is that the research on these vaccines is entirely separate from the ideas and notions of politicians.
Yeah, and also just to add to that, I think, for those who are still asking questions about this, we are treating diabetes, we're treating cancer because of science. We have found solutions. And the same principles that allow us to actually treat those conditions is the same rigor that we go through. We ask people to actually do randomized clinical trials. We evaluate the results. We actually have an independent group review the evidence and then say these results are significant, and then they actually publish it. Once you meet that criteria, we actually say if you have 2 randomized clinical trials that show the same results, at least you have evidence that it works. So I think we need to, and the message that needs to go out is we need to get back to trusting science. Science is not perfect, but we have processes in place to actually catch. We know what we don't know, and we're actually able to manage that as we go forward.
All right. Maybe we can wrap up in just a minute, but I want to encourage our audience to send any more questions our way that they might have. Here's a question from Nicholas Eisen. If you currently have the virus and you take the vaccine, what happens to your symptoms and your illness at that point? Does the vaccine treat the illness?
No, so this is a very important question. So the vaccine doesn't treat the illness. What the vaccine does is it stimulates a response so that when you are exposed to the infection, you are less likely to get sick. So with the 2 vaccines right now, for Pfizer, you need after the first shot, you need 7 days after the second shot for you to achieve the full immunity. And then for Moderna, you need 14 days after the second shot. So if you were, and that's why people need to be very acutely aware of this. If you were sick and you got the vaccine, it does not protect you from the virus that's already in place. But after you get the vaccine and you get that 14 days after, 7 days after the second vaccine, then your chances of getting sick very, very slim.
All right. Another question, and this maybe gets into some of the myths, and some of the misunderstandings. What do we know about mutations and strange variations coming from other countries? I've heard of South Africa, Britain, maybe Taiwan, not Taiwan, Hong Kong. What do we know about these other mutations and variations? How concerned should we be?
So,
what is the likelihood of the vaccine helping us protect?
Yeah, so I think what people need to know is that the press blows things out of proportion. Mutations are a way of life. Viruses always mutate. It's what they do. So, and that's how they survive. So mutation happens. What we worry about is if a mutation is so different that we actually can't manage it. What we know right now with the mutations, the ones from the UK where everybody is all stressed out about, is that there's no evidence that mutation is not responsive to the vaccine. So I think people should talk about mutations and just put it in context. That mutations, viruses are going to mutate, and it doesn't mean that because you hear mutation, it means that everything else is lost. The vaccines are still effective, and unless there's something that different that happens, we do not expect it to be any different.
Hey, Chris, I think a good way before we get into save rounds to end this is I'm both a leader of my family and I'm a business leader. Where do I go, or where do I need to be watching? What websites for when I can get both my supported leaders within my company as well as my family members to get this vaccine? What's the process? Where should I be paying attention? Where should I be signing up to get in line to get this after the required personnel?
So there are 3 areas to get reliable information. One is CDC. So the CDC, Centers for Disease Control, they have a whole slew of information for lay people, processes to help you understand what you need to do, and they set the guidelines for what we need to get done. The second site is NIH, National Institutes of Health. And NIH, or National Institutes for Health, they actually have a dedicated website where the evidence is based on science. Then the third area for businesses is your health department, your local health department, because they are the ones that take what the CDC has discussed and then they implement at the state level. So for example, in Wisconsin, our health department essentially decides, okay, at what point do we now move from health professionals to the elderly, and that decision is made, and then you create a pipeline for how to get people vaccinated. So those are the three areas where you're going to get reliable information. One area definitely not to get information is the press. If you listen to the news and they're telling you stuff, half of what you're being told is just being played up. We need to actually go to fact areas where we actually have the facts.
Leonard, you just made my day and confirmed some of my thoughts and doubts. So, okay, so I think we're about out of time here for today, and let me just ask the other two panelists. Do either of you have any last questions for Dr. Getty?
I know Nayara is going to wrap it up with the three main points from this. First off, Doctor, this quick 45 minutes has given me more information than more factual information, for which it's made me more confident on how to deal with the COVID pandemic, both from a family standpoint, average citizen standpoint, and a business leader. But Chris, I just want to highlight, people were very thankful when the soldiers came home from the global war on terror. The medical personnel, the first responders, the doctors and the scientists are the absolute badasses of 2019 and 2020. You guys, I know, have been working tirelessly to fight this pandemic on our behalf. So I just want to make sure, Doc, you know, from all of the American citizens, we're absolutely thankful for you and the medical staff, and again, the first responders who have been fighting this tirelessly. Thank you for your efforts. I'll leave it at that.
Thank you.
So I'll let Leonard have the last word before Nayara, and I'll just say the only summary point I have is to acknowledge that I think I have a much better understanding of some of the things I don't like to do, like wearing a mask, socially distancing, and the future potential of the vaccine to be a complete game changer. That these are the things we need to get back to business in America. Leaders, organizations, leaders of families, teachers, people who have any kind of role of leadership and authority and influence over with their communities need to be, I think, learning and listening to these lessons. Leonard, do you have any final words for us before we go to Nayara?
Yeah, I think my final words are maintain the social distancing, keep wearing the mask, hand sanitization, and if you get a chance to get the vaccine, get it. Those are my final words, and that's how we're going to get out of this pandemic. And I would say we trust science. Science has worked for us and will continue to be effective. I suspect that by the end of this year, you're probably going to have maybe anywhere from 3 to 7 different other vaccines that will actually become available. So I think we're only we're only going to come out of this on the other side stronger as a result of this.
Nayara, you're up.
Thank you so much for this conversation. I learned a lot. Certainly, I have some main key points, and thank you, Chris, so much. First of all, we started with Dr. Leonard saying that right now there's 22.9 million cases of COVID since March. But why so many people, right? In simple terms, it's because it is a strain that we do not know much about. Facts. Everyone is affected. So it is a thing that we cannot ignore. The key main points on how to prevent the virus are what you already know. Wear a mask, social distance, and hand wash and sanitize. Of course, the hard part has been to make everyone to comply with these behaviors since it affects the daily lives of people. It is not the best thing to wear a mask. But Dr. Leonard brought back how people back in the influenza pandemic had to do and had to respect the same guidelines. And by doing so, they overcame the disease. Another main point is that scientists are not inventing the number of cases and deaths due to COVID. Doctor explained how scientists use many processes to discover the veracity of the results, such as comparing the number of deaths in the same periods on the year before. Hence, scientists have studied and discovered that the only truly difference from this year and last year is COVID. Another point is that the lethality of people without underlying conditions, it is true that people with underlying conditions have a higher chance of dying, but we are seeing that younger people and healthier people are dying as well, or having trouble because the exposure is a lot larger. Another main point is how do we act now? Specifically referring to those people who cannot work remotely, right? Another shutdown could be catastrophic for the economy and for everyone in their household. So in order to stop that, we just simply need to follow the 3 main guidelines that I just spoke about, so the numbers don't keep escalating so quickly. Another main point is about the vaccine specifically. And currently we have data that the vaccines are 93 to 95% in efficacy. And after you take it, your chances of overcoming the effects of COVID in this case might increase. So you have better chances, of course. There are 3 main ways to address vaccines. The first one is by injecting a dead virus to a person. The second is by injecting a dying virus or a weak one. And the third one is the mRNA technology approach, which is basically injecting a synthetic virus on yourself. It goes in your system and creates an effective response without causing much symptoms. And then Dr. Leonard explained how Moderna and Pfizer are using this approach right now. And another important fact is about how to get the best information possible. We can't trust every source that we get, or trusting about your close friend that's talking about the vaccine. So the 3 main resources are CDC, NIH, and your local health department. Lastly, after the vaccination process, in order to go back to what we would call normalcy, there are 3 phases. 1, everyone in your bubble has to be vaccinated first. Then the majority of your state has to be vaccinated. And then lastly, when everyone in the world is vaccinated, or the majority, then is when everything will start to get better. All these phases need to be completed in order to go back to not wearing masks, etc. Because even if you're immune, because you took the vaccine, you can still carry the virus and transfer it to others.
Thank you, Nayara. And before I give the wrap up, Leonard, were there any corrections or comments you'd like to make on Nayara's summary?
No, I'm very impressed. I mean, she literally nailed it. So a really great job.
I told you. All right, folks. So this coming Monday, I hope you'll join us on Monday, January 18th at 12 noon Central Time for the next Talent War podcast, which is titled Bringing on Talent, Hiring Practices. And it will be hosted by George Randall and Carly Walden. Thank you all for taking the time to join us today. We really appreciate it. Again, if you like what you heard and want to continue the conversation, connect with us on LinkedIn, Instagram, Twitter, Facebook, share our posts and these sessions with your organizations, your connections, family, even your friends. And if you want to improve yourself, your team, or your organization, any of our team members are available to work directly with you to achieve success. Lastly, check out talentwar.com or efoverwatch.com to learn more. Thank you very much, and out.